has actually created the problems with lack of affordability in ways that many people are not aware of. But people are being priced out of health insurance and health care because of the government regulations that are making it more expensive to obtain. The whole problem of pre-existing conditions is due to government interference with our tax laws. And Treasurer Mandel will go into that in some extent. So I know you've got plans. I'll tell you all the bad things, and you get to tell them all the good things, the good alternatives.
One of the areas where I think Republicans have gone astray is that there are too many Republicans across the country that are just against Obamacare, and I think we need to be for something as well. And so what we're doing today is laying out a 10-point plan to fix healthcare in America. We started in Cleveland this morning, we've been to Mansfield, and now we're in Columbus talking about my vision for creating a more affordable healthcare vision for our country, and also more accessible healthcare for families and senior citizens. So this is our 10-point plan. We'll give you each a copy of it, and I'm just going to walk through it. I'm going to walk through it. I'm not going to go through every point, but I'll walk through it and then open up for any questions. First, obviously, we need to repeal Obamacare. We need to eliminate what I like to call the federal government takeover of healthcare. This is an area where Senator Brown and I respectfully disagree. We've had debates about it throughout the state, and I believe the federal government takeover of healthcare is wrong for a variety of reasons. But one of the main reasons is because the federal government has a relatively bad record of running businesses. When you look at Amtrak, when you look at Fannie and Freddie, you look at the Postal Service, which is now unfortunately $5.3 billion in the red. Past being prologue, we don't want the government to run our healthcare system because we don't want to have to wait in line for 6 months to see a doctor or 1 year to get a surgery that may save our life. We must protect Medicare. Unfortunately, the Affordable Health Care Act cut approximately $716 billion from Medicare. My grandmother is 84 years old. My parents are 60 and 61. They're baby boomers. I believe it is unfair to change Medicare whatsoever for my grandparents' generation and my parents' generation. In fact, in order to have Medicare for my parents' and grandparents' generation, and for any baby boomers or senior citizens today in America, we need to restore that $716 billion that the Affordable Health Care Act, that Obamacare, cut from Medicare. Dr. Haynes referenced tax equality for health care, and I want to go a little bit more in specifics on that. Right now, people who get their insurance through their employer have a tax advantage that is not available for people who buy it for themselves. They can buy it with pre-tax dollars. This pushes people to purchase their health insurance through their employer, which creates a problem with pre-existing conditions because you can then be trapped in a job. There should be no tax preference whatsoever for any particular way to purchase or own health insurance. I believe people who self-insure should have a tax deduction for their health care costs. The Affordable Health Care Act tries to address pre-existing conditions through a government takeover of the healthcare system. I believe tax reform is another way to get at coverage for pre-existing conditions. And if we could have common sense tax reform and tax equality in this country, we can also accomplish pre-existing coverage. We can also accomplish coverage for pre-existing conditions in that respect. I also believe we need better transparency when it comes to medical costs. In the state treasurer's office, we created a transparency portal to shine the sunlight on how tax dollars are being spent. I believe we can have more transparency in medical costs. When you go out to eat or you go out shopping, you know what things cost. Yet, oftentimes when you go to the doctor's office, you have no idea what it costs, the services you're getting, the procedures you're getting, the tests you're getting. And I think through having more transparency in the healthcare system, with patients knowing what they're paying for and how much it costs, we can bring costs down. I believe in common sense tort reform. I believe junk lawsuits, unfortunately, in America have become an industry. Listen, if someone is wronged in a hospital setting, if there's a doctor who makes a mistake or there's some type of negligence, obviously that person should be able to pursue financial justice and be made whole. However, junk lawsuits should not be an industry in this country, and that's unfortunately what's happened. It's caused physicians like this to too often have to feel like they're practicing defensive medicine. Physicians should not have to feel like they're practicing defensive medicine. Physicians should be able to rely on their training, their expertise to make decisions on what's best for their patients. I believe junk lawsuits in our country also artificially increase the cost of health care and health insurance for patients and middle-class families. And so it's why I support strong and common sense tort reform in our nation. I also support expanding access to health savings accounts. Unfortunately, the federal government, not just in the Affordable Health Care Act, but in other ways also, is working to restrict access to health savings accounts. We should expand access to health savings accounts. We should do everything we can to allow opportunities for citizens to enroll in health savings accounts. We should not mandate it, but we should expand access for health savings accounts. I believe when citizens vote with their feet, quality and access goes up and costs go down. In Indiana right now, they have a pilot program where thousands of their government employees are actually on health savings accounts. Today, there's approximately 10 million Americans throughout our country on health savings accounts. That's a good thing. Again, we shouldn't mandate, but we should make it more accessible.